I am honoured to open today's debate on the report stage for the Mental Health Bill and to have served on the Bill Committee, where it was clear that members across the House share a commitment to high-quality mental health care for those in crisis. And I want to thank my colleagues this afternoon who were on that Bill Committee. It was a very informative, moving and high-quality discussion. It is this commitment to high-quality mental health care that underpins my amendment to New Clause 2, which leads today's amendments. It addresses a critical issue, the inconsistency and inadequacy of care in mental health units across England. We have all, I am sure, heard distressing accounts of vulnerable individuals placed in units that are understaffed, unsafe and ill-equipped for recovery. Families entrust the system with their loved ones during moments of crisis only to find that trust undermined, not by a lack of compassion, but by a lack of national direction. New Clause 2 seeks to change that by establishing a national strategy and annual reporting to ensure every mental health unit is safe, well-staffed and fit for purpose. In my Guildford constituency, a family recently shared with me their experience of a loved one's stay in a mental health facility. The unit was understaffed from the outset. Wards were mixed in age and illness and with little therapeutic structure. There was no clear advocate or caseworker, and the family didn't know who to contact. They described a system that, in their words, dishes out drugs without improving mental health or well-being. The setting was so short-staffed that their loved one was able to self-harm, an unacceptable failure in any care setting. This clause aims to prevent such failures from reoccurring. The Care Quality Commission has repeatedly raised concerns about the safety of mental health wards, citing staff shortages, poor infrastructure and environments unfit for therapeutic care. In 2023, the King's Fund reported that 40% of NHS mental health providers were rated requires improvement or inadequate on safety, figures that would be intolerable elsewhere in the health system. The Health Services Safety Investigations Body has identified systematic risks in inpatient mental health care, including delayed responses to distress, inappropriate use of restraint and lack of therapeutic staffing models, and perhaps most frankly, the British Medical Journal reported over 17,000 serious incidents in mental health services between April 22 and March 23, each one a moment when care went seriously wrong. And these are not just statistics, they represent real people who deserve better. This new clause would require the Secretary of State to publish a national strategy within 12 months to ensure all mental health units meet or exceed good safety standards under the CQC framework, and to report annually to Parliament. It focuses on three key areas: recruitment, retention and training of staff, safe staffing levels and patient-to-staff ratios, especially during nights and peak times, ongoing accountability through public reporting. The clause would make patient safety a national obligation, not a postcode lottery. It's about responsibility and transparency. While the bill modernises detention criteria and patients' rights, it doesn't explicitly require the Secretary of State to guarantee basic safety and staffing standards, and this clause fills that gap. Now, some may worry it's too prescriptive or adds bureaucracy, but it doesn't replace local management. It supports it. It builds on the CQC's role by ensuring action is taken when failings persist. It turns inspection findings into a driver of national improvement. And regarding cost, unsafe care is already expensive. It leads to readmissions, litigation, staff burnout and loss of public trust. A national strategy allows for smarter investment, preventing failures rather than paying for them later. We've had decades of guidance and reviews. What we haven't had is statutory accountability. This clause delivers that. New Clause 2 is focused, deliverable and urgently needed. It complements the Mental Health Bill by ensuring the rights it enshrines are backed by safe, well-staffed and properly regulated environments. Without it, we risk legislating for rights in theory while leaving patients unsafe in practice. By supporting it, we affirm mental health care deserves the same national standards as any other branch of healthcare. I urge members to support New Clause 2 and make safety, dignity and accountability a permanent part of our mental health law. And I look forward to the debate in this House today. Thank you.